We all live with a strong gender identity. We dress as per our gender, we act as per our gender, and in general, we are proud of what we are with respect to our gender. But what if a certain aspect of a body disturbs this gender identity? What if, for example, a man has women like breasts? It happens, friends, more often than we think. And this condition is called gynecomastia. And I, Dr. Kiran Petkar, plastic surgeon at Kauvery Hospital, I'm going to tell you all you need to know about this condition called gynecomastia. We see a lot of adolescent boys experiencing lumps under the nipples. This is very, very normal. But here is the catch. This supposed breast enlargement under the influence of hormone is supposed to be subtle, just a little bit. And there it is supposed to go away by the age of 18 or 20. But in some cases, it is too much or persists beyond that age, and that is when the problem starts. Sometimes, along with the breast tissue, a lot of fat gets encapsulated in that area, and this fat is very, very resistant to diet and exercises. And voila, we have a breast on the chest of a man. Well, there are no medical treatments for this, but the surgery that we use to treat this is very simple and safe and is done on daycare basis without the need for overnight admission. We generally remove this excess breast tissue using a technique called liposuction. It's a keyhole type of surgery wherein through an access of just a millimeters we insert cannulas, and using negative suction we remove all the excess tissue, that is breast tissue and fat, through that hole without making any cuts on the skin. Or sometimes, if the breast tissue is tough and is not coming through the suction, then we make a cut just at the junction between the nipple and the normal skin to remove the gland, so that the final scar is well hidden at the junction of the normal skin and the nipple. So the purpose of this surgery is to give the person a flat, normal looking chest without deformities and without any skin scars. Why? What is the need for such finesse in surgery? That is, if you leave telltale signs of surgery on the chest, then the person is still not free to remove his shirt. That defeats the very purpose of this surgery. That is why this surgery is preferably done by a qualified plastic surgeon who is trained in this surgery. Normally, an adolescent boy with mild to moderate enlargement of the breast tissue does not need any treatment apart from watchful waiting till he hits 18. But in case there is gross enlargement of the breast tissue, or if the enlargement persists beyond the age of 18 or 20 years, or if the person is really troubled by a dysmorphic body image, then a simple plastic surgery can fix it. At the end of the surgery, we advise some compression garment to the patient to be worn for a few weeks. So we want the patient to be able to take off his shirt and not feel shy about his body image in front of his peers. I have tried to give you a gross idea about this condition called gynecomastia. For further information and treatment of yourself or your close family members, visit a qualified plastic surgeon to know more about it.